All right. Um, Good morning, good afternoon, and good evening to everyone joining us from across the globe. I'm Shivani from the Financing Alliance for Health, and I warmly welcome you to this very critical and much needed conversation on the gender case for investing in community health. Now, before I begin, I would like to share something with you. Most of you must have heard of the United Nations campaign, which is the 16 days of activism to end gender based violence. And to set the stage and show our solidarity, here's a quick video that we'd like to share with you. Just allow me to quickly. You, piece of water, the caramel. And the food. Is that the one? And the drum, you the blade when love. All right. So with this, as part of this, we'd firstly like to celebrate the community health workers, volunteers, and promoters, both women and men, for being the backbone of the communities. Majority of this backbone is indeed female, who continue to improve health of the communities, address issues like maternal health, gender-based violence specifically. And at the Financing Alliance for Health, we support CHWs on the ground, and we'd like to share some of their thoughts with you. So here's the video to give you a glimpse into their lives. There it is.
Gender-based violence has been on the rise. We've seen it everywhere, even in media houses, even in the midst of my community.
What we have seen at the community level, there are quite a number of things that cause gender-based violence. So among women, sometimes it's issues to do with getting contraceptions without consulting their husbands. So it becomes an issue. The other thing also financial issues, because sometimes the woman is not working, may have to depend on the husband to provide. So it becomes an issue.
I support GBV survivors in this way. When I identify there is a household with such a case, I have some counseling skills, just get to counsel the client.
I felt that at becoming a community health promoter, I will be able to reach out to the community, create awareness to them about sexual and gender-based violence, and then also to take them through the modalities of reporting sexual gender-based violence cases so that they are able to be assisted.
Why I'm passionate about gender-based violence is because we have witnessed several cases in my unit, and really people are getting mistreated. Even others have even lost their lives.
I want people to know that gender-based violence is not about a violence towards women only, it can also be towards men. And so we need to be on the lookout, and we need to share more so that we are able to help our friends help us. Prevent gender-based violence, we would like that we do a lot of awareness and sensitization activities at community level and at facility level, and also support the facilities to have the resources that are needed to treat these clients, because sometimes those services, they may not get all the services because of the limited setting. So we would like the facilities to be supported and strengthened so that they are able to attend to these clients without any issues.
All right. So, let me pull up the slides for you. And today we'll get insights. As part of our agenda, we'll be getting insights from a CHV herself who has witnessed these issues firsthand, understand the problems on the ground, and why there is a need for gender equity and to invest in CHVs. We also will see what the funders have to say about this, specifically the Gates Foundation, and what they're doing to support the goals of achieving gender equity, especially at the community level. And finally, what steps Ministry of Health, specifically the Kenyan counties, are taking to empower women, make societies more inclusive. Now, our session has three main goals. We want to showcase the stories of community health volunteers and their roles in combating social and health issues like gender-based violence, highlight investment strategies and practical steps to progress towards gender equity, and especially at the community level, and mobilize stakeholders and advocate for investments in gender equity, starting at the community level and inviting them to take accurate action. We will be hearing from our esteemed experts. We have Charity, who is the community health volunteer in Zambia. We have Dorothy, who is the health financing technical advisor at the Financing Alliance for Health. We have Graham, who is joining us from the Gates Foundation. He's the program officer for gender integration. And we also have Director Rusia, who is joining us from the McQueen County government in Kenya. Now, here is our agenda for today. Very good. A bit delay. Here is our agenda for today. So first, we'll shed some light on why it is so critical to invest in the frontline. Then we get into the investment strategies and what the funders are doing to move forward towards gender equity, especially at the community level. We then have some practical insights from the Kenyan government. And finally, we have a Q&A. We'll also try to answer some of your questions and questions like how partners and different organizations can collaborate to achieve this common goal. We would love to hear from you as we go. So please do look out for some polls, which will pop up in the middle. I also encourage you to share your thoughts in the chat and submit questions in the Q&A box at any time during the session, and we'll take them up at the end. You could also mention the speaker that you'd like to ask the question to, and I will direct it to them at the end of the session. All right, so what we do now is we're going to warm up a little bit, and I will raise a poll for you. So here is one of the polls, and please allow me to launch that quickly and have you answer these questions. So you should see a poll on your screen now, and we'd love to hear from you what you think on this. Which issues related to women's rights and equality do you think are most important for our government and society to address? There's 4 issues we've mentioned here. Which do you think do people feel are the most important for the society? I will wait for a little bit more to see. We have our responses coming in. I see where it's going. It's really interesting to see all the answers, because it's moving a lot towards gender-based violence. Too few women in influential positions in the government. That's a big problem as well. But which is the biggest problem in the society, and what do people think? All right, this is super interesting to see. We have a lot of responses that have come up. I'm going to end the poll now. They're coming in. All right, so I'm going to end the poll now. And a lot of you have said gender-based violence is the biggest issue. Then the second is too few women in influential positions in the government. And then we have unequal access to education, and unequal opportunities or pay. So let's see what the results, what the reality is. What we have here is 4 in 10 Africans believe that gender-based violence, GBV, is common in their community. In fact, all of you were kind of right. Gender-based violence is highlighted as the biggest issue in Africa. The second is too few women in influential positions in the government. And third is unequal access to education. And then unequal opportunities or pay. So it is really striking to see that everyone answered the question the same way that that the actual situation is. And African women face some of the highest rates of GBV in the world, with almost 40% of the women experiencing physical or sexual violence in their lifetimes. This is quite striking, and this is one of the reasons that we want to highlight this issue, especially at the community level. So what we're going to do is we're going to dive in and see what's happening at the local level, what are community health volunteers doing, and what they're going through every day. I'm wondering if Charity is here yet for the webinar. If not, we can move on, and then we can invite her at the end. Maya?
She's not on at the moment, but we will wait for her to join.
Okay. That's fine. So we can invite Charity at the end then. I know we've seen a lot that's happening at the local level, and what we can do is we'd love to hear from Charity, her experiences on what she goes through every day, and what are the kind of issues she addresses on a daily basis. In the meantime, let me invite Dorothy to highlight why is there an urgent need to invest in community health and support the frontline. So Dorothy, the floor is all yours.
Okay, thank you, Shifani, and welcome participants and my fellow panelists. So I'll start by what Shifani has projected, that 70% of our community health workers across the globe, they are women. And we already know that community health programs are cost effective. And there's evidence that there's a good return on investment. For example, in Sub-Saharan Africa, we have a return on investment of 10 to 1. And the reason as to why community health workers are important into our healthcare systems is because they have played a very critical role specifically in supporting us in achieving universal health coverage, because they reach the hard-to-reach areas and hard-to-reach population. And this is because they have an added advantage because of the model that we usually use to recruit our community health workers, based on the fact that they are usually recruited, selected by the communities, and they live with the communities. So they clearly understand the social cultural norms that exist within the communities. And when we develop policies for the communities to adapt, then it is easier for the communities to adapt or to accept change from people that they really understand, and who also subscribe to the norms that they live for. And having said that, community health workers, I would align towards, I think it is Salome from Nairobi County has said, one of the service package that the community health workers do deliver that have seen arouse a lot of gender violence is family planning. And this is because of the way our community social cultural norms are, and how community health, not community health, how patriarchal societies are. I'm the woman, but it is upon the man to decide whether I'm going to utilize family planning or not. So I think gender-based violence is something that really needs to be addressed. And I want to underline the fact that the community of workers have really played a very critical role in supporting and referring the gender-based violence survivors to the health facilities, and also linking them to the justice systems. And we are aware that the existing inequalities in our example, for example, the wealth quantiles, the rural versus the urban, the developed versus the developing, and you see indicators and including gender-based violence look very different. And I think that's why community health workers really play a very critical role in this. That is one fold. The community health workers are working in a context where communities, they are known by the communities, but they're still the ones who are referring the communities for services of gender-based violence. And you already know gender-based violence, most of the times it is meted by people who are really known or well known to the people. The perpetrators are well known. And these people, the community health workers also come from the communities. That means on that end, they can be predisposed to violence on their line of duty. And also, I would also like to highlight from where I started that community health workers, 70% are women. And from where they are recruited, they are also recruited from to support and from areas that are of socio-economic settings that are anti-disadvantaged. And having said that, I would also like to highlight that that means they are not exceptions. If 1 in 3 globally are exposed to gender-based violence, it means if you have around 107 community health workers, then it means 24,000, around 24,000 are likely to be exposed to gender-based violence. So we are not only looking at gender-based violence in terms of the communities that we serve, but also the community of workers who are also the potential, they are frontline workers, but they are also potential candidates for violence. So having said that, I think inequalities that exist in our societies, they fuel gender-based violence. And achieving gender equality in women empowerment does not require a business case because it's already a human right that has been stipulated. And we know for us to, I know the people who are looking at the question that Shivani has projected and proposing that education would be a key factor in reducing gender-based violence. It's because once the girls are not educated, they are forced to child marriage, then violence finds space to grow. So now empowering the girl from the beginning and us socializing differently, and I think that is likely to grow us to having a woman who is empowered, who can make decisions. And I think that is likely in the long run going to mitigate gender-based violence. That is my thinking. But I am looking at 5 things that I think should be done differently or that needs to be supported. For example, rights. We already have legislations, but I was looking at our SDG report. And at the current pace, it shows that we are going to take 286 years to close the gap in legal protection and remove discriminatory laws that exist. And even if we do have these laws, it's also good for us to acknowledge the fact that we have broken justice systems. And it is very clear from the kangaroo courts that usually exist in our communities to the, allow me to use the legal systems that are like the perpetrators are arrested. The next time you find them in the within the communities. And I think this is really reversing the gains that we are making policies, but the implementations becomes a challenge. So I think we need a lot of transparency and accountability in the legal justice systems. Another thing is, I think, in terms of resources, I think women should be supported, including the community health workers, to be supported to be in a position to access financial and financial resources or financial institutions for financing, and also have rights. For example, land ownership. When you look at land ownership, and especially in the developing countries, it leans more towards the men than the women. So the inequalities that really exist, even in terms of jobs, because you find that the voluntary work, even the community of workers, you see the kind of population or the gender that is attracting. It's attracting the women, and we also have evidence that once you recruit more men in voluntary work, they're likely to leave. It will face a lot of attrition rate. So having jobs that would attract both jobs that are well, they work with a lot of freedom, equity, and security and dignity for women, just like it has done for men, then I think if you look at women, the household chores that we usually do, or the monetary value that women do, the work that they do globally, at least 10.8 trillion annually. The unpaid work that you do as women, the monetary value for it is around 10.8 trillion annually. That is 3 times the size of the world tech industry. I mean, if the estimated closing gaps of care and services, and by expanding these to decent work programs, it has shown that from the Vision 2030 or SDGs report, 300 million jobs will be created by the year 2035. I think the time that even our community of workers do spend to do the community of work, if it can be compensated for, and even the work that, because women do 3 times voluntary work compared to men. So every time it's like we're doing thrice the voluntary work that is not paid for compared to men. So I think in terms of timings, that is something that would really needs to be looked into, and security. And I think we don't really look like we should be keen on looking at, for example, the global cost for violence against women that is estimated to be at least 1.5 trillion, or approximately 2% of the global domestic product. Then the number of girls living in conflict areas, it also shows a very significant increase. In 2022, we had 640 million girls and women who are living in conflict areas. So there are so many things that as governments we are supposed to work into for us to be in a position to reduce this gender-based violence, because the gender-based violence is, like I've said, it is really escalated, or it's made worse by the inequalities that are existing within our societies. So I think socializing our societies from the beginning, because we know we're in patriarchal society, community of workers would play a very critical role. But something that I would like to highlight is the fact that they should also be considered. The time we are looking forward to them to support the communities, then we're also supposed to look forward to supporting them, because they're also vulnerable. I'm also vulnerable as Dorothy to be exposed to gender-based violence. So I mean, we are supposed to work on the inequalities and look at the discriminatory laws that are existing and see what we can do to strike a balance. But community of workers, for sure, they are very well placed, because they already subscribe to the social and cultural norms, not like really subscribing, but they understand the social cultural context that we are dealing with, and they are trusted by the community. So I think community of workers would play a very critical role in supporting us to mitigate gender-based violence in the communities that they live in. Thank you.
Thank you so much, Dorothy. That was really, really insightful, and especially the fact that you mentioned some of these striking numbers, like the global cost of violence being 1.5 trillion. 640 million women are actually in the midst of conflict and are at the risk of violence. And some of the bigger issues, like when we say CHWs and the Frontline is actually well equipped to address gender-based violence, they're also at a really high risk of gender-based violence. Some of the other things that you said around closing the gap for this and bridging the gap towards this, it's probably going to take 286 years. We can't be waiting for that. And so just as we think about this, I think while it is clear that there is a huge gap for integrated investments in community health and gender, and there's a lot of money coming in which is fragmented, some parallel funding for gender equity, and there's a lot of funding which is going for community health, it is also important to think about how both can be integrated together. We also know that there is a growing $4.4 billion annual funding gap, and this number has been floating around for a while on community health. We also have the Gates Foundation, who has highlighted that in the recent years, only 45% of development aid from governments has considered gender as a factor. Now, we've looked at all the problems and where the gap is, and there's so many issues to address. But if the money is not going in the right direction, it is problematic. So now, what can be done to fill these gaps? And it would be wonderful to hear from the funder himself, from the Gates Foundation. And so I'd like to invite Graham, who's the program officer for gender integration at Bill and Melinda Gates Foundation, with more than a decade of experience at the Gates Foundation and immense experience working global health, gender integration, WASH projects across Africa and India. He's truly a health systems and gender expert. So Graham, could you share with us shed some light on how funders are actually reshaping their investment strategies to support gender equity and empower the frontline? The floor is yours, Graham.
Yes. Thank you, Shivani, and very happy to be here, and look forward to engaging with you all on this important topic. And just in terms of kind of like shedding light on how funders are approaching this, I think in the case of the Gates Foundation, the creation of the team that I am on is one step towards bridging the gap that Shivani mentioned. And so I work on the gender integration team at the foundation, and we're part of the gender equality division. And specifically on my team, what I'm showing here is our theory of change, and really our existence and our goals are to support teams across the foundation in integrating gender into their grants and into their strategies in a way that both amplifies impact in terms of gender equality outcomes around women and girls' health, economic empowerment, changing some of the societal norms that Dorothy mentioned that impact community health workers and women in general. Really amplifying those kind of like gender equality outcomes alongside and in partnership with, in parallel to are the sectoral outcomes that foundation teams are working towards. And so like the malaria team, the immunization team, the primary healthcare team all have very specific goals within their strategies that they're working towards that aren't related to gender equality, but it's our team's job to work with those teams to highlight where there are overlaps between the outcomes that they're trying to achieve and these gender equality outcomes. And there are always a lot of overlaps. And so our team provides the technical support and expertise to be able to design grants and strategies to achieve both health or sectoral outcomes and GE outcomes. And so you might be asking yourself, well, what are you doing? What is the foundation doing specifically for community health workers? And perhaps surprising to some, perhaps not surprising to others, the foundation doesn't currently have a specific strategy as it relates to community health workers. We like I mentioned, have teams that for better or for worse, work in kind of in silos towards their specific goals. And so in 2022, our team kind of undertook a high-level review to understand how the foundation is investing in community health programs and community health workers, and this was kind of triggered in recognition that community health worker, like all the stats that Shivani and Dorothy have mentioned already in terms of globally 70% of community health workers being being women. And so we triggered this review in recognition that community health work is a gender equality issue, and the way that community health workers are implementing and community health programs are implementing within the health system is a gender equality issue. And so we really wanted to understand, okay, we don't have a strategy that unites all of the strategies on community health. Like, there's not a singular community health worker strategy within the foundation, but we do know, we think we have an idea that teams are investing in community health worker programs. And so what you'll see here is that what we found was that the foundation invests a significant amount of money in community health programs. Actually, if you can go back one slide, we'll stick on this one for a moment. What we found is that at the time in 2022, there were 174 active grants across all teams at the foundation that touched on, in some capacity, community health workers. And we kind of used some search criteria. I think like on this call, we've heard community health workers referred to in a number of different ways already. And so we used a bunch of different search terms to make sure that we were being comprehensive, searching within our grants, whether it's community health volunteers, community health promoters, community health workers, making sure that we were looking at kind of all of the ways that workers are defined and kind of things that they're asked to do. And so using those search terms, we found that across 26 foundation teams, like I said, 174 grants and 47 countries, there is tons of work going on at the foundation on community health workers. And so if you can go to the next slide, it just kind of shows the different teams like malaria and polio, women in leadership, MNCH, like all of these different sectors and teams within the foundation, working across a lot of different geographies in programmatic areas where community health workers are critical to success. And so the point of all this is really that the foundation is investing in the area, but not in a coordinated way. And so our team's role has become to identify where teams are investing in community health work and community health workers, and get them really to do it better, and to resource their investments in a way that enables not only kind of the gap that Shivani mentioned to be addressed, but also to make sure that community health programs are being designed to address the strategic gender interests of those in the role. And so if you could go to the next slide, please. What does that come down to? What does that mean in terms of like our investments and in terms of empowering the front line? This isn't an exhaustive slide. It's just provides some examples of how we can do that. And so when for example, the malaria team or the polio team are making an investment that includes leveraging kind of community health programs as a delivery pathway, it's our job to work with them to make sure that from an engagement perspective, they're putting community health workers at the center of design of those programs, and to understanding the specific community needs of women and men in the role, and designing the program accordingly to make sure that they're in their deployment, they're safe. If it's possible to pay or compensate workers in some way, if that's not possible, to at least ensure that that foundation teams are mitigating exploitation of free labor or underpaid labor, which we know is an issue in the sector. Traveling safety, and also making sure that they're providing ways to connect community health workers to redressal mechanisms if they're experiencing harassment or poor labor conditions, and that there are consequences related to those. that those in the role of community health worker that want to advance their career have a pathway to do so, that they're provided training, both on skills to make them successful in the role, but ideally with general life skills like digital literacy or financial literacy that they might not have had access to in other places, that will empower those in their role in their lives kind of more broadly, and then also measuring the impact of this work. And I think what's critical for the foundation approach to like investing in all things really, but also in thinking about gender within teams investments, is that it's critical to be able to highlight that yes, empowering community health workers, empowering women in the role does lead to kind of like measurable GE, gender equality progress, and also makes the health program and the health outcomes that teams are going for achievable more quickly. And so can we go to the malaria team and say, you know, if you do these things in program design, not only will you empower women, empower community health workers, but also these malaria outcomes that you're going for, whether it's like a reduction in burden or kind of like increase in indoor residue spraying or something like that, those will also come more quickly. And so it makes the case that Dorothy was talking about for investment in those things that seem straightforward, but we want to be able to measure and show that impact. And so I think I will stop there, but that is a high-level overview of how the foundation is approaching doing this important work.
Thank you so much, Graham. That was super insightful, and some points that you've made, specifically highlighting that it is still nascent. Things are coming together. It is not super comprehensive yet. It's not well integrated. Gender is not really super integrated across the organization, but also globally as well across different programs, different issues. Health is sometimes segregated, and there's a lot of fragmentation, but that doesn't mean that the work's not happening. There's immense amount of work that's going into the area. The Gates Foundation is doing a lot to be able to integrate gender in one way or another into each of those programs at whether it's vertical programs, horizontally, and trying to bring everything together. And thank you for highlighting such valuable points. Now, I would like to take a brief pause, and I would like to come back to the audience. So I'm looking at you to help me answer some questions. Now you need to take a guess, audience, on this question. What percentage of women in Africa are unemployed or engaged in unpaid jobs? Now, this we've highlighted a lot in this webinar, but it's time for you to guess and tell us what you think about this. What is the percentage of women in Africa who are employed in unpaid jobs or unemployed? So I'll wait for a few more seconds, 30 seconds to get your answers there. We have a lot of answers coming up. It's clear that nobody thinks it's less than 20% or less than 30%, which is interesting because not really interesting. It's quite expected because we've highlighted that a lot, and it is pretty clear globally that there's a lot of women who are unemployed or engaged in unpaid jobs. In fact, community health volunteers themselves, they're often unpaid and engaged in part-time work. So the answers show that. Okay, now I see some people have clicked less than 20% and 30%. All right, so let me end the poll and let's see what the answers look like. So you're kind of right. Most of you said that there's a lot of women, more than 75% of women who are either unemployed or engaged in unpaid work, such as caregiving and subsistence farming. So that is true. And it is really scary, the figure when we think about it, because the amount of contribution that women are making to the economies and healthcare, it is immense. And if they're taken out of the equation, it is going to be a really devastating world. So just thinking about it from that point of view, it is, again, more and more clear that there is a need to really invest in women and make women become a part of the economies in a more formal way. All right. So I would like to now move on to the next part of the session and look at what government is doing to address the need and address these problems. So we've heard Graham give his really wonderful insights, but I'd like to now hand it over to Director Rusia, who is the Deputy Director of Gender and Social Services for Makueni County from Kenya. So she's going to give us that perspective from the government and what the government is doing on ground to give us these very important insights and the practical steps that the government is taking towards addressing the issue of gender inequity. So I'll hand it over to you, Director Rusia. Director, I just want to check if you're able to speak. If your audio is working, let me see.
I am audible now.
Yes, you are. Yes, Director. Please go ahead.
Yes. Actually, we are doing a lot in Makueni after realizing that the same percentage that has just been discussed, 70% of our CHPs are women. So Makueni is not an exception. And so from the government perspective and looking at the vulnerability, the issues that they face as CHPs, our community health persons, we have come up with policies that are able to protect them. We have sexual and gender-based violence policy. We have a gender policy. We have social protection policy. And we have other policies that not only look at the CHPs alone, but also CHPs who are persons with disabilities together with the rest of the population that is vulnerable. So other than the policies that we have developed as a county government, we also leverage on the national government laws that are there to protect them. Now, as we speak, we are developing a bill for social protection, because we realized that even when we have policies and they are not anchored to law, then at times they may not be implemented, or the strategies may seem a mirage. So Makueni is developing a social protection bill that aims at protecting vulnerable persons, including women, children, youth, persons with disabilities, and now look specifically to those who have responsibilities like our CHPs, which make them more vulnerable than others. The CHPs are the persons who will come to the household, look at the issues that are affecting the household, the health issues, and then after looking at them, they are able even to provide data to the health sector. And let's say in the just to ensure that the household's health issues are communicated to the authorities, they are themselves exposed to situations where at times they face a gender-based violence. Again, you'll all realize, and I know we know that when poverty comes through the door, peace escapes through the window, and peace goes with love. So when these CHPs all are just given a stipend for survival, they are actually not given what we call a salary. They are not remunerated. You'll find them taking home almost zero at the end of the month. Because, for example, in Makueni, Sancode, for government, they are given 2,500 Kenya shillings. And if they are renting a house, because not all of them are able to afford land and build their own homes, some work from rented rooms. Once they pay rent, they almost have nothing to take a home to invest in any project that can give them money to take care of their other domestic needs. So in Makueni, we are actually thinking through supporting them, bringing them into groups and trying to empower them, trying to give them skills that can enable them start savings, even if from a very small point, and then grow to joint investment. For example, investing in the businesses that can assist them have some returns or some money to survive on, and even educate their children. In the past, the CHPs were working purely on volunteer basis, but as we speak, after the policies were developed and strategies are now being implemented, though not without challenges due to thin budgets. We all know about government budgets, which are growing thinner and thinner every day. We are looking at ways, so after bringing them together, building their capacities to ensure that they are empowered enough to start small businesses, and hence with their income, they are able to stand up and speak. And some of the situations that make them more vulnerable and susceptible to sexual and gender-based violence are reduced.
Director, I think we lost you a little bit there in the end. All right, I think there is some audio issue on Director's end. But let me, all right, let's move forward and we can have Director answer some questions at the end as well as she speaks. We seem to have lost her. All right, so as we move on, and before I dive in to the Q&A and also invite Charity to speak, I would like to highlight some things with you and some of the resources that we'd like to share with you. So there's one important resource, which is the Framework for Action for Achieving Gender Equity in Community Health Workforce, which is developed by our collaborator and partners, National Health and Integrate Health. And they have developed these 16 recommendations to address challenges women face, specifically community health workers face across their careers. So please have a look at it. It is dropped in the chat. We've put the link in the chat if you'd like to have a look. It is very well laid out and super insightful. The second big thing that we'd like to share with you is the new tool that we've recently launched, which is the Community Health Financing Assessment Toolkit. It is an evidence-based self-assessment tool to aid stakeholders in developing innovative and equitable financing strategies for community health. So it is fully automated, based on global best practices, and it's a self-assessment tool. So if you'd like to understand what is going on with your community health program and locally in your communities, and you'd like to get more resources for your program and address the key issues within your community health programs, either it's at the national level or at the local, county, or subnational levels, you can have a look at this. We've already shared this tool with 14 plus countries in just 3 weeks, and we've piloted this in Senegal, and that has helped them develop the 5-year action plan. We've also put this link in the chat, so if you'd like to have a look at this tool, please do, and access the link and request it. I see Director Rusia is back. I will let you take over, Director. If you have any final thoughts. Sorry, we lost you there because of the audio issues. I know technology is a big challenge these days. But yeah, handing it to you again.
Thank you. Thank you, Shifani. We thank God. I don't know at what point I went off, but I was talking about the policies that we have in Makueni County and the current legal framework that we are developing as we speak, the Social Protection Bill. We have had our CHPs going home with no pay at the end of the month after doing so much work, visiting the households. And remember, in Makueni, we have a population of slightly above 1 million. To be precise, 1,042,300. So if our CHPs, who the 70% apply as women, are able to visit all these people, it means they do a lot of work. Now, the government came up with a policy and decided to give them a stipend of 2,500. But we still feel that this is very little. If some of them have to pay for their rented rooms, some travel when it is expensive, they at times have to walk. Sometimes they use motorbikes because they are at the village level. They are called community doctors. So they actually do so much, including being the same ones
I think we're losing you again, Director. This is really disheartening to not be able to have to not be able to hear your insights clearly. But unfortunately, in the interest of time, I will have to move forward and
we are experiencing. Sorry. Do I take it?
Yeah, sorry. Yes, sorry, Director. I think we're losing you there a little bit. But yeah, if it's working, please feel free to go ahead.
Yeah. So I have been saying that we are doing a bill that seeks to empower our CHPs. That's how we call them in Makueni. And we have a fund that is the Makueni County Empowerment Fund that targets to actually empower, give a socio-economic empowerment to our vulnerable communities, including the community health promoters, persons. And so this fund was saying as some little interest compared to what the financial institutions give, because the fund is given at 2%. I will say that Makueni has moved some steps recognizing the work that the CHPs do. However, we still have challenges, financial challenges. When we want, for example, to take them for a training, as I mentioned earlier, they are our actually community doctors. Those are the terms they are referred to, the titles they are given at the community level, because they have to keep checking on the patients with non-communicable diseases. They are our link between the government and the households. And so they have so much work. I think before I went off, I had mentioned the population of Makueni being slightly above 1 million, and they have to keep ensuring that right at the household level, everything is fine. Now, we have strategies that we have other than the policies I mentioned earlier. We have our CIDP, that is the County Integrated Development Program that guides the programs for the county for the next 5 years. We also have the Community Health Policy 2020-2030 and the Strategy 2021-2025. So in this one, it is aimed that the community health unit savings and loanings associations will be supported, will be, we'll have sensitizations happening so that these community health persons are brought into groups. They form groups, they are capacity build, and then they can be assisted with nurturing of the saving culture so that they are able to save and then start small businesses. We have seen the past such support enabling people to graduate from vulnerability. We have seen many having their resilience built. We have been able to assist them build their self-esteem. We have been able to assist many become even employers at the end of the day when their small businesses grow. So it is possible to protect them socially, protect them economically, and capacity build them to ensure that they are able to handle the tasks that we give them as a community without challenges.
Amazing. Thank you so much, Director. That was really insightful, and I feel really bad that the internet didn't support some of it, but it was really, really insightful, and we're super keen to also upload this later. So we'll be uploading it on YouTube and yes, so we'll be uploading it on YouTube, and we'll also share an article which has all of these amazing insights put together. But yes, thank you again, Director Rusia, for sharing these insights with us, specifically around social protection and the savings and loans that are being provided as part of these smaller but really robust initiatives at the local level, and they're able to empower community health, specifically women as well. So yes, we're almost towards the end of this session, and I would like to invite everyone to share their questions if they have any. You're free to raise your hands as well. I see that there is a very interesting question in the chat, which is a very big question. there is a question from Esther Loy, who said that there's so many problems that the world is facing. And unfortunately, this unique and very important community health service is just being recognized by many governments. I don't know if is this a question. It seems like Esther's put a comment. Yes, Esther, that's true. So Esther's highlighting how it is really unfortunate that most of the community health workers have no measurable finance and remuneration scale. We have another question that I saw in the chat, which is, in a resource-constrained world where the world sees it's at risk of jeopardy and troubling economic and financial issues, especially post-pandemic, when unemployment and financial issues become giant, this is a really loaded question there, how self-sustainable opportunities can be created, or issues of gender equality, financial freedom to women, etc., can be feasibly addressed and implemented. Now, this is a really big question there, and I feel like all the world leaders can come together to really brainstorm on it. But let me actually point to Graham a little bit. If you have some insights, just to put a little bit of structure or pull out something from this question, and you'd like to highlight something which you've not already mentioned in your presentation.
Yeah, thank you, Shivani. Happy to comment on it. Though I agree with your assessment of this might be better for world leaders to work on. But I have a couple of reactions. One, when it comes to community health workers and community health work in particular, I think this is where it's critical to ensure that as a sector we aren't relying on volunteerism, specifically unpaid and underpaid work from women, and so whether that's like formalization within the primary healthcare system within a country to ensure that that those in the role are paid, I think that is what's necessary for long-term financial opportunities to be created in the community health sector. Is that the roles need to be formalized, and so I think that that should be what we're working towards. My other thought on this, I guess, just in kind of like broadly speaking, creating more financial opportunity for women. I think that what you're referring to here are normative interventions and changing the norms around who at a household level who has agency over financial resources, and so there's the earning side of it, and then like the agency over the resources side of it, and that I think creates financial freedom. And so continuing to work within communities to address norms or other barriers that might prevent women from having that financial freedom, and recognizing that those are things that change in the long term, and so it takes time to do that work, and just yeah. And so I think I'll stop there, but I think it speaks to formalization of the work on one hand, and then on the other hand also focusing on reducing harmful gender norms that might prevent financial freedom from women in the long term. So I don't know if that is a specific enough answer, but that's how I reacted to the question.
Yeah, thank you so much, Graham. No, I think that's a fantastic answer to this very loaded question, and yeah, thank you for those insights. That's super important, especially formalizing, and it's just those small little steps that need to be taken from all different stakeholders that in the work that they're doing, and eventually we see that it becomes it just magnifies, and we see the impact. I do see one very important question, and it must be voiced by Hezron, who said that it was a good presentation, but there were no voices of the men in the videos shared for CHPs in addressing GBV. And yes, that is true. And it is not that we don't want to share men's voices. I think men's voices are the most important, and we talk about gender equity and gender equality in the sense that both men and women should have equal access to opportunities in whichever field they are. So we did not do that intentionally. It is just the fact that most of the women who are community health volunteers and who are on ground, they are women. So when we're interviewing people, it is much more likely to come across women and them sharing these insights. But we will take this as a really important feedback, and we will upload some really wonderful videos by the work that's being done by men, CHWs on ground, and they're also super supportive and empowering this idea of making sure that both men and women get equal opportunities and equal pay and are recognized. But they also face a lot of challenges as well. So that's point well taken, but also it's just unfortunate that we have more women who are unpaid and they're volunteers and they face a lot of challenges on ground and who are CHVs. So we wanted to highlight that. And yes, we see that. Yes, we've also put a link in the chat where we have some videos of the men's voices. So please do have a look as well. But thank you for that feedback. That's a really important question. I would also like to ask a quick question on how different partners can work together. So we see that Gates Foundation is doing the amazing work. We also see that government is having its initiatives. The private sector has also played a role in different ways, and everyone together is doing a lot. But how can everyone best come together? Is my question. To be more specific, are there specific initiatives that have been implemented in the past few years where the private sector has come together effectively with the government, or there's been great public-private partnerships, or is there any initiative that comes to your mind when you think of collaboration and effective collaboration that can happen in different spheres to make these things work and create impact? So this is what I would like to ask. I see, Graham, you're on the screen, so I'm sorry. I'll have to come back to you again. And then I'll go to Dorothy and Director Lucia after that. And that'll be my final question for this webinar before letting everyone go.
Yeah, I'm happy to start, but I mean, I think what comes to mind as like effective kind of coordination and across kind of government and partners would, I mean, first and foremost be the CHU for UHC platform in Kenya that that Financing Alliance for Health is a part of, and that seems to be really effective in terms of like policy progress and bringing together kind of a huge network of partners that each kind of work on something different and distinct within the country context. And so that's what comes to mind first and foremost. I think there are for public-private partnerships, there are some other examples from the foundation side. I know that we operate something called the CEO Roundtable that is a group of like CEOs from pharma companies, and they kind of will select initiatives to kind of give charitably to. And I know that community health workers is something that they have started to look in and look at and are kind of like growing in this space also in terms of where they're directing their kind of like charitable work. And so something to maybe keep an eye on. I'm not fully up to date on that, but it is something that kind of private partners are starting to engage in a little bit more.
Yes, thanks so much, Graham. That's really helpful. We'll definitely keep an eye on that and do some digging ourselves. And yeah, thank you for sharing the work that Financing Alliance for Health is also doing, and yeah, in terms of coming together with governments and really making impact. So CHQ for You at Sea, the platform that we've been working on. The link is also in the chat if anybody is interested and would like to have a look. Dorothy, let me invite you quickly before we end the session today. If you have any last comments on this, I'll also invite anybody who wants to ask a question, they can raise their hands. Final few minutes. Yes, so Dorothy.
Okay, I think for me, I'm very aligned with what Graham has said, but also to recognize the fact that governments are the heaviest funders for our healthcare systems. And the collaboration between even the line departments still remains a challenge. And I think as Financing Alliance for Health, that is what we want to tap into, especially for the domestic resource mobilization. What Rushia was saying is these income generating activities for the community health workers, so sustainable financing for community health workers, is likely to be hosted by a different department and not Department of Health because of their specialty. So if we get an extra budget from the Department of Gender, we get another department like agriculture, because they also leverage on the community health workers to support in terms of budgeting, and we pull the resources together, then I think that will be a plus. So it will start from inside the government organizing itself, collaborating between the departments, and I think specifically for Kenya, counties have gone, I have seen they have started doing their One Health strategies to just work in collaboration between the different line departments. So unless we streamline the intersectorial collaboration, the resources would still, because gender is not a standalone, it is cutting across all the sectors, agriculture, education, health, climate, environment, everything is gender. So for governments, I think we have to start organizing from within, as we also coordinate the partners to resource pool for the government. That is what I have. Thank you.
Thank you so much, Dorothy. That's such an important point, and thank you for making that. The government needs to be on the driver's seat, and they need to be the owners and leaders of programs in their context, and that's how things will become sustainable. So that's what we're moving forward towards. And yes, great point, Dorothy. Thank you so much for that. So now, as we close, firstly, thank you to the audience for staying and joining in different time zones. And thank you specifically to Graham, because he's joined from the US, and it's probably in the middle of the night. So thank you, Graham. But thank you to the other speakers, specifically Director Rusia, Dorothy. We also have other people who managed this webinar in the background. So a shout out to Joseph, Maya, Joel, Dr. Sanjeev, who's a gender expert. Thank you for the engagement as well and the enthusiasm that everyone's shown throughout the webinar. So a big thank you, team. You can also learn more by enrolling in our Financing Community Health Programs course. So there's a lot of work that we are doing as FAH, and just go to the website, and I would suggest go crazy because there's so much to look at. We will also share the session recording soon, and you must check out our FAH YouTube page, the website, social media channels. There's wealth of information, and if you'd like to collaborate, please do reach out to us. We'll share our emails in the chat as well, and all the links are there. But do watch out for our video that will come out soon, which will be this webinar itself and an article summary of all the wonderful insights from the speakers. Until then, stay safe, keep advocating for gender equity, and continue to champion community health. Have a great, wonderful